All right. I'm back, motherfuckers. All right. So, I've got to do some of this online education shit. So let's get it done. All right. Okay. Our patient is spontaneously alert and no distress. Head is atraumatic. Pupils are equal and reactive to light. Extraocular motions intact. These patients got no JVD, no evidence of head trauma. Slightly stiff with moderate pain and with flexation. It's alert and oriented, no distress. Clear bilaterally. Cardiac rhythm is regular rate and rhythm. No bruising. Chest wall. Abdomen is soft and non-tender. No bruises. No evidence of back trauma, no tender, no evidence of trauma, no pain, no edema, skin's warm, dry, no wounds, no rash. Alert and oriented times 1. Alright, so it's pretty disoriented. Disoriented place and time, doesn't know where he's at, no motor. Deficits, non-focal, non-facial asymmetry, speech is clear, stroke screen's next to not having a stroke, GCS is 14. His eyes are opening, but he's kind of disoriented when his conversation does away. So he's kind of confused. Okay. Let's take a look. Strip is looking normal. Okay. So if you just jumped on, I got 2 or 3 classes I got to take that I'm kind of behind on. Well, for last month, this month, that I need to do. So for my paramedic stuff, so I'm just my online classes. So I'm doing it now. I might as well let you guys learn something or two or jump in on that. Because why not, right? All right, let's get into the video. All right, let's take the pretest. All right, let's do a pretest. Which is accurate regarding pediatric altered mental status? Most children do not receive their routine childhood immunizations. Most children do. Grand mal seizures are not typically found by a period of confusion. No, that's not true. They usually are confused. Temperature is an important vital sign in children with altered mental status. Yeah, I would say that's one good. Most children will have a febrile seizure during their childhood. Most children, they do, but they don't. That's hard to say because not a lot. There is a lot of children with a high fever that will do that, but temperature is an important vital sign in children with altered mental status. Well, if they are altered, temperature can be important. Let's go with that, especially when they're altered. The most appropriate course of action with suspected child abuse is which of the following? Call law enforcement, ask the suspected abuser to apologize. You apologize to the child right now. Restrain the suspect and abuser. I'm going to go ahead and restrain you until the cops get here now. Confront the suspect and abuser now. We'll call law enforcement. Which of the following causes uremia? Kidney failure, liver failure, heart failure, or stroke? Let's go with kidney failure. 2 new followers on Instagram. Okay. Which of the following mnemonic is for remembering the cause of altered mental status? So let's go with altered mental status is tips AEIOU. Which of the following is true regarding pediatric altered mental status? Isn't that the same thing? Which of the following? Oh, it's worded differently. Following is true regarding pediatric altered mental status. Hypoglycemia is treated with salt replacement. I think not. Drugs never play a role in a child with altered mental status. Following is true. No, that's false because it does. Alcohol never causes altered mental status. False. Cause of child abuse should be reported to law enforcement. That is true. Let's see what I got. 100%. Woo woo. Okay, that's the pretest. That means shit. So let's watch the video now. And we got to answer questions based on the video.
Come on, man. What's wrong with you?
Trees, basketball.
Are you serious? Get in the car. I'm gonna take you to the hospital. You're not acting right. What is wrong? Do you know where you're at?
Grandpa's house.
No, you're not at Grandpa's house. Do you know who I am?
Grandma.
Quit playing around. I need to know if you're all right. Do you know who I am? I'm your father. Tell me who I am.
Grandpa.
You know what? I think this is the fire station right here. I'm gonna take you to the fire station right here.
Just fair warning, the acting in these videos suck like no other. As you can tell from the kid. Yeah. This is the shit I have to deal with for computer classes, but we do a lot of in-person training instead, but this is just supplemental.
Hello, I'm Gary Hughes, Fire Chief with the Daytona Beach Fire Department. Daytona Beach is located on the east coast of Central Florida in Bush.
Oh. So every month is a different fire department that they feature.
Of Bush County. With a resident population of roughly 64,000, our city is host to hundreds of thousands of visitors annually who come to Daytona Beach for such events as the Daytona 500, Bike Week, Spring Break, and Black College Reunion. Daytona Beach Fire Department operates 7 fire stations and responds to over 17,500 calls per year, 85% of which are EMS related. Along with special events and daily response calls, our department is challenged with hurricane and wildfire seasons. We are honored to be featured in this edition of Medic Monthly. Dr. Steve Katz. Steve?
Thanks, Chief, and welcome to this edition of Medic Monthly. Altered mental status in the pediatric population is a challenge for EMS because depending upon the child's age range, there are many different possibilities to explain a child's altered mental status. Being familiar with the many common and not so common reasons for pediatric altered mental status is important for today's EMS professional in order to ask the right questions, look for critical clinical clues, and to assess children in a methodical fashion.
Something's wrong with my son. I need help.
Come in. In the scenario you have just witnessed, our crew is presented with a 13-year-old boy who has been acting confused for the past 1 hour. His father brings him to the fire department, concerned about his son's recent confusion. He says that his son is normally healthy and has never exhibited similar behavior in the past. There is no known trauma or recent illness.
Yusuf, can you take the father into the training room and do an interview and have Chris Bush do a survey of his car? That's all right with you?
Yeah, that's fine.
The lead medic immediately calls for a thorough interview with the patient's father and an inspection of the family vehicle.
Yes, sir. Why don't you come on, yes, sir.
Have Mike and Adam bring the ALS equipment in, please.
The father is led into a separate room for a detailed interview. Parents can sometimes unintentionally cause additional stress on scene. However, if your child needs to have their parent present, or if in your judgment it will be helpful, by all means keep the parent with the child. Our lead medic kneels down in front of the patient, introduces himself, and speaks in a calm, reassuring manner. He also takes the time to explain what is going on to his 13-year-old patient. Remember, EMS professionals can look pretty frightening to a child. From their perspective, you are strangers in uniform who have noisy gadgets and scary appearing equipment and sometimes use confusing medical terminology. Taking the extra time to explain your actions in simple terms will help calm and reassure your pediatric patient and allow the call to proceed more smoothly.
Hey Josh, I'm a paramedic with Daytona Beach Fire Department. Can you open your mouth for me, please? Just gonna take a look.
ABCs. Our patient's
stuff
airway
done.
is
I know,
clear
right
without
behind them,
signs
yeah.
of obstruction. Breathing is unlabored with a
behind.
rate of 16.
Hey Josh, I'm just gonna put a little bit of oxygen in your nose. It's gonna
How you
take a
doing,
little
man?
bit, but it's not gonna hurt, okay?
Oxygen is applied.
How's
Pulses are
life
present
on
and
the other
strong
side,
at a rate of
somewhere
100.
else?
While our crew was beginning the workup of our patient, the scene survey
Where'd you end
and
up going to,
interview
Nebula?
with
Was
the
it-
child's father
Not for
is
a person.
simultaneously taking place. The car that the child
For
was
Rucker, right?
traveling
Or no,
in
it was for
when he
Hood,
started
right?
acting confused
That's
is
right.
inspected for possible clues that may explain our
Nega just wanted
patient's
to car
symptoms, like pills or medication bottles, toxins, drugs, or even signs to suggest carbon monoxide poisoning. A thorough scene survey is always an important piece of the puzzle. Be alert to the condition of the scene. When evaluating a home scene, assess if the living environment appears potentially unsafe. Is the home clean? Are there potential hazards like open containers of alcohol, drugs, home cleaning agents, or chemicals? Are there signs of foul play? Identifying scene safety issues can be very useful to personnel at the hospital and can allow them to better disposition an at-risk child to an intervention that may improve the life of a child. What is your immediate treatment? From the information you've been given, your immediate treatment is crew safety, scene safety, ABCs, oxygen, history, vital signs, physical exam, and if paramedic care is available, establish an IV, perform a blood sugar evaluation, and consider Narcan administration.
Adam and Mike, can you get a full set of vitals, including a temperature and blood glucose level, please?
No problem.
Yes, sir.
As soon as the ABCs are finished, our lead medic begins to ask our patient about his past medical history.
Hey, Josh, I gotta ask you a few questions. Do you know where you're at right now?
Grandma's
See your
house.
arm for a minute.
Hey, did you hit your head on anything?
Watermelon.
Do you know where you're at right now?
Watermelon.
Grandma's house. Appears like we're gonna have to get a whole history from the father. He seems very confused.
I understand.
Our patient is too confused to provide any useful information. At the same time, our patient's father is also being interviewed regarding our patient's past medical history in the other room.
This is not normal for him. That's why I had
He's
to break him.
never been like this.
No, not at all.
What about any trauma?
No, no trauma.
Past medical history? None. Our patient's father states that all developmental milestones have been met. Medications? None. Allergies? None. Social history? No known tobacco, alcohol, or drug use. Our patient lives at home with his parents. Family history? There is no known family history of seizures. Last meal? Unknown. Vital signs are extremely important in the pediatric patient population. Sometimes, particularly if you are in a situation where you are unable to uncover an accurate history, vitals may be the only clues available to gain insight to a patient's condition. Don't neglect any of the vital signs. An abnormal blood glucose or presence of a fever can help you quickly uncover the reason for your patient's altered mental status. Being familiar or having ready access to the various vital sign ranges for different aged children is important. An abnormal blood glucose or carbon monoxide level can also be quickly addressed and treated. Our patient's vital signs.
His temperature is 101.1. His blood pressure is 110/70. His respiratory rate is 16. His pulse rate is 100 and regular. His O2 sat is 99 on room air, 100% on O2. His blood glucose level is 105, and his carbon monoxide level is 3.
Got a fever.
The AVPU system is an excellent method to assess and describe a child's mental status. Different adjectives like lethargic, stuporous, and comatose mean different things to different people. So classifying the degree of altered mental status in children with the standardized AVPU system is helpful as it is more descriptive. A, alert. The child is spontaneously alert. V for voice. Child is not spontaneously alert, but alert to voice. P for pain. Child is not alert to voice, but is alert to painful stimuli. U for unresponsive. Child is unresponsive and not alert to either voice or painful stimuli. Documenting your patient's mental status as specifically as possible is also important. During the interview, the patient's father states that his healthy son has been acting confused and disoriented for the past 1 hour and is progressively getting worse. He tells our crew that there has been no known trauma, no recent illness, no recent medication use, no depression or recent suicidal ideation, and no known ingestions. He has no history of seizures or family history of seizures. His baseline mental status is normal, with today's mental status being much different than his baseline. It's always a good idea to ask how the patient's present mental status compares with his or her baseline mental status. Our patient lives with his mother and father, has no known disabilities, attends public school, and has no behavioral issues.
Are his childhood immunizations up to date?
No, they're not up to date. I don't believe in the immunizations, and we falsified his paperwork at school just to keep him in school. So, no, they're not.
The father admits during further questioning that he is opposed to childhood immunizations. His child has never been immunized, and he has been falsifying his son's school records so his son can attend school
Right,
despite
constantly at
not
school.
having
That's
been
why he's leaving.
immunized.
Hey Josh, we're gonna check you out head to toe. We're not gonna do anything to hurt you, okay?
Physical exam. Our patient is spontaneously alert, no distress. Head is atraumatic. HENT exam shows his pupils are equal and reactive to light.
Any neck pain?
Extraocular motions intact. No JVD, no evidence of head trauma.
Stiff neck
Put
or
a
anything?
little bit of pressure on your neck and pull it down. You let me know if it hurts, all right?
Ow.
Meningitis?
Okay, guys, we have a fever and we also have nuchal rigidity, pain in the neck. Let's go and put some respiratory protection on.
It's a mask.
As soon as the lead medic
Meningitis.
determines that the patient has a fever and neck stiffness, he appropriately directs his crew to utilize their respiratory mask
So
for
bacterial
infection
meningitis, maybe?
precautions. Neck, slightly stiff with moderate pain with flexion, an important clue. Lung sounds are clear bilaterally. Cardiac exam shows a regular rate and rhythm, no bruising to the chest wall. Abdomen, soft and non-tender. No bruises or signs of trauma. Back is non-tender with no evidence of trauma. Extremities, no evidence of trauma, non-tender. Skin is warm and dry with no evidence of wounds or rash. Neuro exam. Our patient is spontaneously alert and oriented to person, but disoriented to place and time. No
So he
motor
knows where
deficits.
who he is, but not where
Non-focal
he's at.
exam. No
That's right.
facial asymmetry. Speech is clear but confused. Glasgow Coma Scale
Fever,
is
stiff
14.
neck,
As
altered
the eye opening is
meningitis.
spontaneous, he is disoriented and converses,
Let's see if he's alert to voice. Josh, open your mouth.
and he obeys verbal commands. When performing a history and physical exam of the child with altered mental status, consider the possible causes of altered mental status of children with the mnemonic TIPS AEIOU. T for trauma, thermal, tumor. Always ask about trauma. Kids don't always tell adults about recent injuries. Look for signs of bruising or injury that may explain a child's altered mental status. Look for signs of head trauma. Is there any bruising present? Is there bruising around the eyes or behind the ears that may indicate a basilar skull fracture? Does the patient complain of a headache? Is there an elevated temperature that may explain a child's confusion? Is there any reason to suspect a heat-related emergency? Infection examples include meningitis and encephalitis. Intracerebral vascular disorders would include subarachnoid hemorrhage. Infection and sepsis are common reasons for altered mental status in children. Temperature is a very important vital sign to obtain, particularly in the child with altered mental status. The patient with altered mental status and a fever is much more likely to have an infection as the reason for their altered mental status. Meningitis and encephalitis will often be accompanied by altered mental status in children. Poisoning and psychiatric causes. How about ingestions? Is there a suspicion of intentional or unintentional overdose of medications or drugs? Does the scene survey reveal any open medicine containers or chemicals that may have been accessed by the child? Is our patient depressed or having a history of psychiatric illness? Psychiatric reasons for altered mental status should always be something to consider, but never something to assume in the pre-hospital environment. Always look for other possible causes and avoid making assumptions. Seizures. Seizure or intracerebral bleeding can cause altered mental status. Ask parents and caregivers about history of seizures, febrile seizures, or any shaking activity that may be resembling a seizure. 25% of young children will experience a febrile seizure at some point in their childhood. Asking about recent fevers or recent illness can help determine if febrile seizure is a possibility. Intracerebral shunts, typically placed in children with hydrocephalus, can malfunction, causing altered mental status. Alcohol, acid-base disorders, and abuse. Alcohol in any form, whether it's ethanol, ethylene glycol, or methanol, can all be possibilities for a
Methyl
patient's
death.
altered mental status. Just because a patient is underage does not mean that alcohol is not a possibility to explain your patient's symptoms. Always ask about alcohol and drugs. and look for clues that may suggest alcohol or drug intoxication, such as scene survey and the odor of alcohol on the breath. Remember, patients with diabetic ketoacidosis from hyperglycemia can also have a breath odor similar to alcohol. Avoid making assumptions. Also, any suspicion of child abuse should immediately prompt a call to law enforcement. Encephalopathy can be caused by hypertension, Reye syndrome, septic shock, and HIV. Electrolyte abnormalities like high or low sodium levels, high or low glucose levels can all cause altered mental status. Insulin-related causes of altered mental status include hypoglycemia and hyperglycemia. One of the most common reasons for altered mental status is hypoglycemia. This typically occurs in the insulin-dependent diabetic who has either not eaten enough or may have an underlying infection. Hypoglycemia is easily diagnosed with a blood glucose check and is easily treated by administering oral glucose or IV dextrose. Metabolic abnormalities such as hyperglycemia in the poorly controlled or the undiagnosed new onset diabetic child will often be accompanied by altered mental status. Opiates and other drugs of abuse are notorious for causing altered mental status. Even with pediatric patients, always investigate and ask about the possibility of drug abuse. Track marks are an important clue that may indicate IV drug abuse. Uremia, although uncommon in the pediatric population, is caused by renal failure. Methodically using the mnemonic TIPS AEIOU and reviewing all possibilities will make you much more likely to uncover the reason for a child's altered mental status. What is your interpretation of this patient's EKG?
Normal sinus. That's 106, that's not. I guess that's accurate. Like normal. Put it at 106 and sure. That's fine. 120.
Based on the information you have received, what is your preliminary diagnosis? Based on our clues of our patient having new onset altered mental status with a low-grade fever,
Yeah, it was 13 today.
and the absence of any information to suggest trauma, seizure, overdose, or other common causes of pediatric altered mental status, our preliminary diagnosis is altered mental status possibly caused by an infection
Meningitis.
and possibly related to the child not receiving his normal childhood immunization.
Stiff neck. What up, Gurky?
What happened to our patient? At the emergency department, our patient had a spinal tap revealing bacterial meningitis caused by Haemophilus influenza, a rare cause
Got it
of
right.
meningitis.
What do I win?
Now that children are routinely immunized for this bacteria.
What's up,
patient
Gurky?
was
Thanks for the
treated
follow.
with IV steroids
What's going on,
and
man?
antibiotics and had a stormy course in the ICU. He subsequently recovered with some residual
trying to catch
hearing
up on
loss
some,
as a
OTAP.
result of this life-threatening infection. The hospital also had child welfare services involved, as the patient's father withheld his childhood immunizations and falsified his school immunization record. Let's review the treatment of pediatric altered mental status in the field. First and foremost is patient safety. Maintain the patient's airway, administer oxygen, and if there's a possibility of trauma, take spinal precautions. Vital signs and temperature. Conduct a scene survey and perform a non-judgmental interview with any family or bystanders. Call law enforcement if there is suspicion of child abuse. If paramedic care is available and your patient is hypoglycemic, treat with IV dextrose or an oral glucose preparation. If your patient has had seizures, treat with IV benzodiazepines or rectal Valium. Consider Narcan administration for all patients with altered mental status. IV fluid resuscitation should always be initiated per departmental protocol.
GFR additional training
Perform
for
frequent
Sure.
reevaluations. And finally, try to keep your patient calm by acting
Can
non-threatening
learn something or two
and
from it
explaining
and then
your actions.
apply it in the city. Get promoted quickly.
Hi everyone, I'm Nicole Levine and welcome to this edition of Documentation Minute. There are numerous causes for a child's altered mental status. Your job as an EMS professional is to look for all possible clues that may lead you to the reason behind a child's altered mental status and to document both
Little
pertinent
Johnny's
positive
altered
and
mental
negative
status.
findings. Does the child have a history of seizures or febrile seizures? Is there a
Little Johnny
family
in this
history of
video.
seizures? Is there any reason to suspect child abuse? Does the child have any unexplained bruising or wounds? Does the child appear malnourished or appear to be living in a less than hygienic environment? Does the child have any history of alcohol or drug abuse? Is there evidence of track marks to suggest IV drug abuse? These are all important questions to address and document in the child with altered mental status.
Very true.
How about
very
recent
true.
head
Felix.
trauma? Did your patient fall today? Or how about falls in the last few weeks? If you suspect that a trauma may be a factor, cervical spine immobilization on a backboard should be considered. What is the patient's temperature? Documenting a temperature and asking about any recent possibility of infection is always a good idea. Has there been any recent cough, headache, neck pain, or shortness of breath? Have there been any sick contacts? As always, your careful attention to detail and your careful documentation of that thoroughness will be beneficial to the patient and potentially beneficial to you if the case is later reviewed. Thank you for joining me for this edition of Documentation Minute.
It has been a pleasure filming this edition of Medical Monthly with the highly trained professional men and women of Daytona Beach Fire Department. Pediatric altered mental status presents EMS with many challenges. Taking care of the sick child is always stressful. Be thorough. Interview all bystanders. Perform
I know,
a
these
scene
are
survey,
made years
perform a
ago.
thorough history and
They look
physical
like
exam, and
probably
document
back in the 90s the
all
way
of
the
your
footage
findings.
looks like, but
We'll see you next time with another topic
they rotate
featuring
through.
another EMS agency
It's usually a
with
couple
the next
years old.
edition of Medic Monthly.
So
When we're
every
checking
month
for
I've got a
altered
different
mental status
category I
for
gotta
children,
go
we're doing
watch
the
and
ABCs.
take
We're looking for any
tests
history
and
that
stuff
they
like
might
that.
have.
Just online continuing
either on
education.
scene or with the
So our
parents. We're
OTEP program
administering,
in our
Narcan, and we're also
county
checking the
or
blood
in our
sugar levels.
department
We
is
teach our crews
every month
about
is a
fire
different
safety,
online
scene
video
safety,
with questions and stuff like
continuously
that.
train
Go
about
over
on it
stuff.
because
Then
what
we
we
got
want
to
to
do
do
a
is we
protocol
want to make sure
section
if there's
within our
anything
county protocol
suspicious
test
that
section
we
of that.
notify law
And
enforcement
then we
or
do
get
also
the appropriate
hands-on
authorities involved
stuff in
to
person
investigate the
classes
situation for the safety of
and actual
ourselves and
so
our patients and
this is
whoever
just one part of many
we're happy
things we
to
do
treat.
every month for the medical side. But not sure when. Usually these are probably about 4 or 5 years old, potentially. And I got 29 of 45 minutes done. Yeah, this is my IRL. You think I'm just watching this for fun? Going through this pain and suffering just for fun? For Dystopia? No, this is for my IRL job, so I gotta get this shit done. I'm 1 month behind. Usually, you can't go back behind. You can't be behind more than 3 months. But I didn't do last month's yet, so as long as I knock it out and keep up the train, send them on their way. All right, let's see. Time progressing. So assessment case part 1. All right, there are many different possibilities. Explaining child's change of mentation. Begin being familiar with the common and not so common reasons for pediatric altered mental status for today's EMT professional. Asking the right questions, looking for critical. On this call, lead medic immediately calls for a thorough interview. Okay, let's just go through here. While our crew, we just went ahead and watched it. I don't need to. Tips AEIOU. Mike. I always ask about trauma. Kids don't always tell adults about trauma. So pretty much they're just reiterating basically everything that we just watched in the video. So I just kind of skip next. They're talking about infections. Potential causes could be poisoning, psychiatric causes. Basically, they're crazy, taking meds, stole meds. If they have seizures, could be explained. So the whole thing is altered mental status in in the pediatrics. So what are things that can cause altered mental statics for children? So this is what we're kind of going over things. So seizures, for seizures, febrile seizures, they're altered because they got a high, their temperature's high and it's causing the brain to fry and cook. So then they kind of are altered that way. They have a history of seizures, epilepsy. They hit their head and have a seizure. They have low blood sugar and end up having a seizure. Because seizures end up with a postictal state where they're confused and are altered. Hypoxia, lack of oxygen can lead them to be altered. They have an infection, overdose on medications, drug abuse, CNS. Febrile seizures it talks about. Avoid making assumptions just for the fact that if you have high blood sugar, sometimes you're blowing off ketones and it smells like alcohol. So with that alcohol, it's kind of, don't, make assumptions that they're an alcoholic. Because someone that you may think is an alcoholic may just be diabetic with blowing off some ketones. Insulin. Someone who takes insulin does not eat, then the blood sugar goes low, and then when you have low blood sugar, you become altered because you don't have enough blood, or enough sugar in the blood to keep the brain going. Anemia, kidney problems, holding in all the you're peeing too much, things like that. Child abuse. So I have a timer, 33 or 45. So I got about 12 minutes before I can actually finish the class. So you may watch the video again. We'll see. Airway is clear without signs of obstruction. Yeah, we got a good airway. So basically everything with this kid's evaluation in the video was good, minus the temperature. Yeah, he had 101 degree temp, so a little low grade fever. He also had a stiff neck when there's a head to toe exam, and a stiff neck plus fever is the most common symptom in meningitis, bacterial meningitis. So that kind of puts you to a point where, like, hey, the guy might have meningitis. He meets a couple of the criterias. Let's go ahead and put our mask on just in case. And then you find out what else may cause stiff neck, depending on muscle strain, trauma, things like that. AVPU is our little way we measure how alert they are. Do they alert just by talking, or alert only when you talk to them, or they alert and respond to you only when you hurt them? A little painful stimulation, poking their fingers, pinching them, things like that. Okay. C-spine. Maintain the airway. Yes, yes. Spinal tap. They did a spinal tap on him and found out he had meningitis, so we were right. We were good. Good guess. Alright, so now here's the test. And after I get the test, I got 10 minutes. I gotta sit there and wait before I can go on and do the AVPU system for describing a child's mental status. The U stands for unresponsive. In the AVPU system describing a child's mental status, P stands for pain, which is true of febrile seizures. Most children will develop epilepsy. No. High incidence of future mental retardation. No. Typically not dangerous, which is true. Typically caused by a brain tumor. No. So febrile seizures are typically not dangerous. Just the fever. And with children that have febrile seizures, it's not necessarily the high temperatures of having a fever of 104, 105, which does play a part, but it is the quick increase of temperature going from 98 to 105, 104 in a quick period of time. Jumping that fast in temperature within an hour, or within an hour or two, going instead of gradually getting high temperatures, that's where it becomes the problem of a seizure. Febrile seizures, the quick increase temp. Consider blank administration for a patient with altered mental status and suspected opiate overdose. Opiates would tell me Narcan. So let's go Narcan. In the AVPU system, for describing a child's mental status, A stands for arousable alert, which is accurate regarding pediatric altered mental status. Most children do not receive their routine child immunizations. No, most children do. Grand mal seizures are typically not followed by a period of confusion. No, grand mal seizures generally are confused afterwards. Temperature is an important vital sign with children in altered mental status. Yes, temperature is an important vital sign. Most children will have a febrile seizure during their childhood. A lot of children do, but not most children. So we'll go stick with the temp. Temp is an important vital sign. Which of the following is true regarding pediatric altered mental status? Cause case of child abuse should be reported to law enforcement. Yes. Alcohol never causes ultimate. False. Drugs never play a role. False. Hypoglycemia is treated with salt replacement. False. So it is this one. In the TIPS AEIU mnemonic, the S stands for seizures and shunt malfunction. Which of the following is a mnemonic for remembering the TIPS AEIU? Examination of the blank can be helpful to determine if the patient had a recent seizure. Tongue. See if they bit their tongue. Submit. And we got 100%. Yes. But I can't go on to the next thing because I've got how many minutes left? Side. I have not met the 45-minute thing yet. So let's see, where am I? 37 out of 45. All right. So just kind of click through it, take the final survey. Let's go back here. Completion progress. 100. Got like 5 minutes to kill. Let's see, where are we minute-wise? 37. Oh, we got 13 minutes. All right. Okay. But if we go to another module and start that, then the timer stops. So we don't want to do that. We watch the video, first 15. Watch this great acting.
To over 17,000.
Sometimes use confusing medical terminology.
Put a little bit of oxygen in your nose. It's going to tickle a little bit, but it's not going to hurt, okay?
Oxygen is applied. Pulses are present and strong at a rate of 100. While our crew was beginning the workup of our patient, the scene survey and interview with the child's father is simultaneously taking place. The car that the child was traveling in when he started acting confused is inspected for possible clues that may explain our patient's symptoms, like pills or medication bottles, toxins, drugs, or even signs to suggest carbon monoxide poisoning. A thorough scene survey is always an important piece of the puzzle. Be alert to the condition of the scene. When evaluating a home scene, assess if the living environment appears potentially unsafe. Is the home clean? Are there potential hazards like open containers of alcohol, drugs, home cleaning agents, or chemicals? Are there signs of foul play? Identifying scene safety issues can be very useful to personnel at the hospital and can allow them to better disposition an at-risk child
so it should have
to an
about 5 minutes
intervention
left
that may improve the life of a
close
child.
out this module. Even though we passed the test.
What is your immediate treatment?
We got 5 minutes to kill. If I don't move around
from the information you've been given, your immediate treatment is crew safety.
So if I don't move around within the course and like watch a video or do something, the timer doesn't move forward. So I think we've got, let's see where we're at. 6 minutes left. 6 minutes. But if I go to a different module, it doesn't count. No, the timer doesn't continue. It'll put the timer towards that module. So let's find 6 minutes of video to watch.
What about any trauma?
No, no trauma.
Past medical history? None. Our patient's father states that all developmental milestones have been met. Medications? None. Allergies? None. Social history? No known tobacco, alcohol, or drug use. Our patient lives at home with his parents. Family history.
All right, be right
There is
back.
No
1 minute.
known
You're gonna get
family
some
history of
kombucha.
seizures.
Wow.
Last meal? Unknown.
I'm waiting.
Vital signs are extremely important in the pediatric patient population. Sometimes, particularly if you are in a situation where you are unable to uncover an accurate history, vitals may be the only clues available to gain insight to a patient's condition. Don't neglect any of the vital signs. An abnormal blood glucose or presence of a fever can help you quickly uncover the reason for your patient's altered mental status. Being familiar or having ready access to the various vital sign ranges for different aged children is important. An abnormal blood glucose or carbon monoxide level can also be quickly addressed and treated. Our patient's vital signs.
His temperature is 101.1. His blood pressure is 110/70. His respiratory rate is 16. His pulse rate is 100 and regular. His O2 sat is 99 on room air, 100% on O2. His blood glucose level is 105, and his carbon monoxide level is 3.
The AVPU system is an excellent method to assess and describe a child's mental status. Different adjectives like lethargic, stuporous, and comatose mean different things to different people, so classifying the degree of altered mental status in children with the standardized AVPU system is helpful as it is more descriptive. A, alert. The child is spontaneously alert. V for voice. Child is not spontaneously alert, but alert to voice. P for pain. Child is not alert to voice, but is alert to painful stimuli. U for unresponsive. Child is unresponsive and not alert to either voice or painful stimuli. Documenting your patient's mental status as specifically as possible is also important. During the interview, the patient's father states that his healthy son has been acting confused and disoriented for the past 1 hour.
Welcome to the e-learning for HIV/AIDS. This course is designed to enhance your ability to identify the importance of proper training for your role. This course provides instruction, evaluation, and knowledge checks and is presented in a linear format. Please read each page and review the associated materials thoroughly. The course consists of the following components: course summary, course instructions, course sections, knowledge check quizzes, and a final exam. Please note that the knowledge check quizzes which appear after each section are not graded. You will only be graded in the final exam section of the course. If you do not pass the final exam, you are allowed to retake the exam 2 additional times. Also, keep in mind that your progress through the course is tracked, and if you log out, you will be able to log in at a later date and continue the course from where you left off. Once you have started a course, courses in progress are listed in My Dashboard of your account. This course provides first responders with the knowledge to understand the impact of HIV and AIDS on the community, including risk factors and treatment measures. This course provides instruction on preventative measures to keep first responders safe while serving their communities. At the end of this course, the learner will be able to identify HIV/AIDS risk factors, explain safety measures when faced with potential HIV/AIDS exposure, and distinguish between the various treatment and prevention options. To begin, let's discern fact from fiction with this short activity. Read the 10 statements about HIV/AIDS and determine if they are fact or fiction.
Oh yeah, it's been muted. Thanks for that. I've been talking to you guys all this time. And yeah, I was asking King Reaper, I'm like, yeah, I don't know what question, because by the time he posted the chat, I was like well past the questions on my end. So because of the delay, I'm not sure what exactly he was referring to, but he didn't answer back. So I was like, okay, you know, I'm sitting there reading all the questions myself and breaking things down. And you guys didn't hear it. RIP. Alright, more than 1.2 million in the United States live with an HIV infection. I don't know the numbers. I was a bit. So let's go with sure. Why not? Worldwide homosexual contact is a primary choice. Not even. Well, that's what they believed it was, but he doesn't take that. Let's go fiction. Fake. Women who become infected with HIV can pass the virus to their baby during pregnancy. That's not. I don't think. We'll find out. I don't know. It's not like herpes. I don't believe, where you can just like pass it through the vaginal wall. HIV is spread by infected mosquitoes drawing blood as they bite person. False. Fiction. Let's see where I'm at. 80%. Not too bad. All right. So okay. So women can pass it. All right. So, all right, HIV is spread through mosquitoes. Nope, correct. So we got 1.2 million. All right. HIV is found in saliva. I guess yeah, it can be in saliva. It's below transmission. Currently, only 60% of HIV know their status. Exposure to HIV saliva is Yeah, it's not a high-risk occupational exposure. It's not just homosexual contact. HIV is transmitted through blood. Okay, so affects women can pass it on. That's a good thing to know.
In this first lesson, you will learn about the global scope of HIV/AIDS and HIV/AIDS in the U.S. You will gain an understanding of what HIV...
Dear God, it's one of these modules where you got to sit there every 2 minutes and wait for them to actually be done talking. It's painful.
This course seeks to shatter the fallacies surrounding HIV/AIDS and instead provide information regarding the realities of this disease. To begin, let's look at some of the worldwide statistics to date. According to the World Health Organization, at the end of 2015, there were approximately 36.7 million people worldwide living with HIV/AIDS. Of these, 1.8 million were children under the age of 15 years old. Most of these children were in...
You know what, I'm going to come back to that class. Because that one, at least on stream, is not entertaining at all. And I know you guys want to feel my pain, but I can do that privately. Just run it up in the background and play the game or something. All of the following are considered urgent patients. What? We've already taken this class. Let's go to appendices. Here we go. Review completed course. Course was completed 7 minutes ago. Did I take this? I'm confused. Let's go to my assignments. We got to go to transport guidelines, which is not started. There we go. Okay, somehow the wrong course loaded up. Alright, so transport. An incapacitated and violent patient may be restrained, placed on involuntary commit, and which of the following may transfer via POE? Law enforcement may transfer second, transfer by family. Let's go law enforcement. Incapacitated and violent patient may be restrained, taken by Ellie. Okay. A step 2 trauma can be taken to the nearest available trauma receiving hospital. True. A patient with an unstable airway will be transferred to the nearest. So yeah, unstable airway goes to the nearest hospital. A 7-year-old pregnant patient is having extreme right-sided pain and has been bleeding for approximately 3 hours. Her blood pressure is stable, vital stable. Patient less than 20 weeks pregnant. Please select the description most accurate below. Patient should rest at home and take over-the-counter pain. No, less than 30 weeks is considered non-viable. False. Patient shouldn't get patient care. Because of age, no, has nothing to do with that. Less than 20 weeks is considered non-viable. Yes. An injured patient is classified as such because they do not meet treatment protocol. They are injured but also have a pre-existing medical condition that requires transfer to the hospital. No, they are not of significant trauma to warrant an ambulance ride. They're injured but do not meet step trauma. Yeah, that works. 80%. What did I get wrong? Step 2 trauma. Step 2 trauma, taking the nearest available. Yeah, you still have to stay within there. Step 2. Let's go step 1. You can go anywhere, but yeah, that works. You want to, step 2 and step 1, you don't want to go to the nearest trauma. You want to go to a level 2 trauma center, as it is. You could probably get away with level 3, but step 2, those high ones, we only have one particular step 1 or level 1, which step 1 can still go to. But usually most of the hospitals in our area are all level 2, with a few that are level 3. Alright, ALS versus BLS transfer guidelines. Yeah, boom. Let's go through Pierce County receiving facilities. Next. These are all the hospitals in my area. There's a lot to choose from in our area. All within 20 minutes. Recognized, that was just inner. High reviews are state level 1. Man, I gotta finish this, and then I gotta get my area clean for my Nordic track. Transport to an onward direction base stations. Medical patient with unstable airway transported. Okay, sure. I think I've officially fried my brain. Yeah. To go through this through medic school, and then we have to do this every month at different. There's so much, so that's why we break it up into months. But some of this stuff is just beaten to us a horse, and a lot of it is on a call on the street. We have our protocol book. Certain questions we'll look up and go, but and just end up knowing just from based off of doing it so much. But and some of us like, yeah, we haven't done that in a while, so. And I don't particularly transport all the time, only once in a while. I am actually just a medic on the engine who will get off and stabilize until a transport gets there. And if it's serious enough, I'll ride on the back and I'll help transport. Or if we go into a city that doesn't have a transport, I'll hop on theirs and transport as a medic when they have an EMT ambulance. A BLS car, I'll turn it ALS myself. And that's when it comes into play for transport destination, knowing all this particular protocol. But this protocol is more for actual transport. Intoxicated patient. Judgment calls. Okay, Pierce County has three level 1 stroke facilities that are staffed according to the chart. Yeah, I forgot the capabilities. So we have three. Now you got Maddie. No, you went level 1, St. Joseph. Level 1 stroke. I only got 2. That's right. Teaching St. Joe's, because MAMC is level 2. There's a trick question. No, there's not 3 in the county. There's only 2. All right. Recovery Response Center is what type of receive for patients recovering from strokes? The Children's Psych Ward Detox Center for Pierce County. You are caring for a trauma patient in whom you can establish a stable airway, which are the following most appropriate. Go to the nearest receiving hospital. If the transport of an ALS patient will be delayed longer than the time it takes a BLS unit to transport to the receiving facility, the BLS unit will contact base unit and transport the patient with their permission. Wait until witness with the ALS unit consult. ALS units will wait on scene for ALS until it's arrived now. U.S. BLS unit will transfer patient and follow up once they receive. How that works. Step 3 and 4 trauma patients may be transported only to St. MAMC nearest hospital. Step 3 and 4 traumas may be transferred to nearest available trauma receiving hospital of any level or any nearest available trauma receiving hospital of any level. Yeah, step 3 and 4 can go to any hospital that got the capabilities. You can go to step 3 and 4. You can go to Good Sam, which is not listed here. So yeah, trauma patient with any blank will be transferred to the nearest receiving facility. Unstable airway. Pierce County has 3 level 1 stroke and falls. They had the 2 that we saw. Which facility do you transfer pediatric trauma patients in Pierce County? It would be to Mary Bridge. The correct medical base station for patients in Pierce County equal to or less than 15. This could be Mary Bridge. You respond to a 50-year-old female who was leaving the commissary and on an onset of weakness, ground level fall. Just minor bones and bruises. Her heart rate 78. BP is 102 or 36. Dex is 78. G 4560 does not want to be transferred. Patient would require a respond to a 56-year-old female who was leaving the commissary and had an onset of weakness. Ooh, so she had a weakness and a ground level fall. I would do an AMA because of that onset of weakness. Where did that weakness come from? Vitals are normal. She's alert and orange. She can definitely say no. She's good to say no. But why did she have that onset? I have no idea, and I can't say it. So I'm going to have to go against medical advice rather than let her go sign in the AMA and call in a doc, rather than saying that she just tripped and fell for no reason and it's not going to happen again. Injured patients are those individuals who are injured but do not meet STEP criteria classified injured by the basic meet true. Submit. 80%. That's good. I missed one question. I don't know which one I missed, but I'll take it. Stable airway. Next. I missed 2. That's fine. I don't give a fuck. I'm getting it done. Let's go to assignments. So the only one left is HIV. And that I'll start another time when I have more time. So I just got this one is stuck in here. These are just extra classes I can take if I need it for my recertification, which I should be good. This one I know has been stuck in there since 2018. I don't want to listen to the pay station, so all I got left to do for this month is the AIDS one, which I'll do later. That's gonna take a while. Alright, cool. I'm done. Good shit. Now I gotta go clean up this area, make room for the Nordic track. Alrighty guys, thanks for hanging out. Maybe I'll maybe on my next OTAP when I actually do this more regularly, I'll throw it up on the stream for those that are interested in some kind of medical shit where you guys can fry your brain some more and maybe learn something or two that aren't really in the medical field, but you maybe can learn a few things. Alright, talk to you guys later. See you in a couple hours, hopefully maybe when the Nordic track shows up. Alright, bye.